This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Hemophilia is a rare but debilitating bleeding disorder in which the blood does not clot normally.
They can actually bleed into any parts of the body. Majority of bleeding episode in people with hemophilia is internal. So sa loob ng joints or mga muscle bleeding or intra-abdominal. So rarely do they bleed externally like, well, when they undergo surgery like circumcision or tooth extraction, then they can bleed profusely after surgery.
Today, the battle against hemophilia continues.
First, they have to educate themselves about hemophilia. Because if you know the disease and if you know what to do and what not to do, so if you are well-informed of the disease, para kang empowered.
What are the symptoms of hemophilia? What can you do to avoid complications associated with hemophilia? All these and more tonight on MedTalk.
Joining us tonight is Dr. Edwin V. Rodriguez, a pediatric hematologist of the UST Hospital and Associate Professor of the UST Faculty of Medicine and Surgery. Also joining us is Dr. Marilu Abiera, Pediatric Hematology-Oncology of the Cardinal Santos Medical Center and Secretary of the Philippine Society of Hematology and Blood Transfusion. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening,
Hi, good
Angel.
evening. Tonight we'll be talking about hemophilia. From what I understand, it's a disease that has been passed on by Queen Victoria to all of her children. But what exactly is hemophilia and how do we understand this rare disease? Dr. Abiara?
Hemophilia is actually a bleeding disorder. It is congenital, meaning it starts from birth, and it is inherited, meaning may genetic background yan. So a female, no, actually it's called, it's a sex-linked disease, meaning to say that the abnormal gene is placed on the X chromosome, and therefore the female having two X's, one being abnormal, can pass it through to his sons and to some daughters.
Mm-hmm. Hence the link of
being
the
sex-linked.
origins, yes, being
But sex-linked means that since there are only one X in the male, it's the male that manifests the disease. And there are two X's on the female side, wherein the normal X deactivates the abnormal one. Therefore, females are carriers.
Okay. And can the female pass this on to their daughters, or is it only passed on to their sons since it's the abnormal gene?
By virtue of genetics and inheritance, yes. But as I've said, daughters are carriers.
Okay. You mentioned bleeding disorder. Let's get to know more about what is a bleeding disorder in relation to hemophilia?
Well, a bleeding disorder is a condition in which manifestations related to easy bruising, bleeding in the gums or mucous membranes, or in females, prolonged profuse menstruation. Now, in order to understand how bleeding happens, we have to know that there are three important components of bleeding. One is the blood vessel, the second will be the platelets, and the third will be the clotting factors or the coagulation factors. And if, for example, a patient has a cut, okay, all these three components simultaneously work to form a blood clot and stop the bleeding. So the blood vessel constricts or closes, the platelet forms a plug to stop the bleeding, and the clotting factors form on top of the platelet to seal the clot. So any disruption in the blood vessel, the platelet, or the clotting factors can lead to a bleeding disorder.
So the normal individual who suffers a cut or goes through surgery will have all these three that you mentioned in order, so to speak.
Yes. In order to stop bleeding, all three components must work effectively and simultaneously.
But when one has been diagnosed or when one has hemophilia, how do these three affect the person or the patient?
All right. Now, in hemophilia, the problem is in the coagulation or clotting factors. And therefore, in hemophilia, there is either a defect or a deficiency in one of the clotting factors. And therefore, lacking one clotting factor means the clot may not be effectively formed. And therefore, it is easy for that patient to bleed over and over again. Now, aside from that, platelet function is also affected in hemophilia. That's why there are some drugs which may not be safely taken by hemophiliac patients. And so basically the problem is a deficiency or a defect in the clotting factor of a child.
Okay. So you mentioned a child, no? And we go back to this being inherited. Since you're pediatricians, what are the manifestations of a child who has hemophilia? And let's take into consideration hemophilia A and hemophilia B.
Okay, you begin to suspect a patient or a child with a bleeding disorder when, one, we get a history that this child had incurred hematoma with a simple injection following a immunization. Sometimes we get history of recurrent bruising, especially over the bodies that tend to be, not susceptible to trauma. Like for example, sa body, and then the bruises kind of bigger and deeper.
How do they look like, or what color are these bruises?
No, the bruises usually will range from, if it is fresh, from dark blue, no? And then as it resolves, then it changes its color from dark blue to green to yellow and so on, no? The thing is, once the parents would notice that, then they go to the pediatrician. Pediatrician would try to request for basic tests like simple CBC and platelet, and then the simple coagulation test of PT and PTT. And usually in hemophilia, it's the PTT that is abnormal.
PTT again is?
It's a partial thromboplastin kind. It's a clotting test. So it's done ex vivo. It's done outside the body in the laboratory. So there's a normal range for that. And usually it takes time for the clot to form. And so they began out to suspect that the result is abnormal, then they are subsequently referred to a hematologist where further testing are done and confirmed, no? And usually we confirm it by doing assays. So we do assay or try to quantify the factors, no? And commonly, we request for factor 8 and 9 because these are the ones that are most common.
What are factors 8
Okay,
and 9?
these are proteins. These are proteins that are necessary to produce the clot. And so, if these are lacking, then your tendency to form a clot is impaired. And when we say, so factor 8, factor 9, so there are actually 1 to 13 factors, no? So 8 and 9 are the most common. So factor 8 deficiency is called hemophilia A, and factor 9 deficiency is called hemophilia B.
Okay, so is there a difference between the A and the B that is
Well,
more
clinically,
common?
well, if we base it on clinical manifestations or the way they appear in terms of signs and symptoms, there is no difference because the clinical manifestations involve mostly the joints, bleeding in the joints and bleeding in the muscles. However, if we do the laboratory tests that Dr. Abiera was mentioning, we can actually differentiate hemophilia A from hemophilia B because of the missing clotting factor. And may I just add that it is common for pediatricians to be the gatekeepers of hemophilia because once once an infant becomes mobile, they start to crawl or creep or walk, and bleeding happens mostly in the joints or muscles, then they can be immediately suspected of having a bleeding problem. And one of them is hemophilia. Now, there are also other situations where you can accidentally discover hemophilia during dental procedures, tooth extraction, and for males, circumcision. So these situations which you think are so common can become occasions where you discover a bleeding problem because of the unusually prolonged bleeding episodes in these patients.
We'll go back to talking more about hemophilia, but we have a caller on the line, doctors. Joanna Santos. Hi, Joanna.
Hi, Hazel.
Hi. Please go ahead with your question for our doctors.
Okay, can you possibly acquire hemophilia as an adult, or is it only inherited?
Thank you, Joanna. Doctors?
Actually, hemophilia can be both acquired and inherited. The acquired form is more common among adults, and usually it's associated with an immunologic disorder, like, for example, SLE. And well, I'm a pediatrician, so I don't have any experience with adult hemophilias, but they do bleed a lot. The only difference is that the joint bleeding is, I don't think it's very common in acquired hemophilia. It's more of deep-seated skin and muscle bleed with acquired hemophilia. Whereas in inherited hemophilia, the most commonly involved bleeding sites are the joints and the muscles.
When we say of bleeding joints and muscles, sometimes our visual of bleeding is one that we see. You know, one that is actually gushing, one that is actually very present and non-stop.
Very visual.
Very visual, no? But when you say joints and muscles that are bleeding, how do you describe that?
Well, it can also be very visual because in a bleeding joint, the joints become swollen. Sometimes they become red because of the inflammation. And the same goes true for muscles which bleed. They're also swollen and very painful. And we can see most of our hemophiliac patients with limping gaits, meaning they cannot walk straight because especially in the knees or in the foot where the bleeding, or ankles where the bleeding happens, it can immobilize them or make it difficult for them to walk. So you can actually visualize bleeding in the muscles and joints because they are basically swollen, and and over time the bleeding joint becomes deformed and therefore is very visually appreciated as a deformed joint.
And not to be mistaken as arthritis.
Well, it can be mistaken as arthritis, and in fact, hemophiliacs who repeatedly bleed in joints can develop arthritis, especially if the treatment is incomplete and the blood clot is not completely removed. It can become a focus of tissue formation that can become actually a secondary form of arthritis.
Actually, may I add?
Yes, doctor.
The most important symptoms with joint bleeding actually is pain. So when these patients would complain already of pain, especially if they are unable to move it, then that's an evidence that the patient is bleeding in his joints. The danger, this is now the danger with our severe hemophiliac patients. The recurrent bleeding can destroy actually the cartilages, the bones in the joints. And therefore, if the bones are destroyed and damaged, then this may lead to disabilities.
So does hemophilia mimic other bleeding disorders?
Yes.
Yeah.
What are these bleeding disorders that mimic hemophilia?
The most common will be another inherited or congenital bleeding disorder, which is the most common benign bleeding disorder, and that is von Willebrand's disease. In fact, there is one type of von Willebrand's disease that resembles hemophilia. Now, the big difference is really one, von Willebrand disease can affect both males and females. And two, the missing clotting factor is also a protein, but it is called von Willebrand factor. And von Willebrand factor is a carrier protein of factor VIII That's why it's not impossible to mistake one from the other.
Over the other.
However, von Willebrand factor also attaches to platelets, and so it can look like a bleeding disorder that is due to a platelet problem. And one more thing common about von Willebrand's disease is that there is a positive family history, meaning brothers, sisters, parents, aunts, uncles may also have a similar bleeding problem. And the bleeding is mostly in the skin, so nose bleeding, easy bruising, and in the mucous membranes. So gum bleeding, nose bleeding, and in females, prolonged profuse menstruation.
So this is common, or this is
Oh, yes.
manifested in both the
Males and females.
males and females and children and adults.
Right.
Actually, they said that von Willebrand's disease is even more common than hemophilia. But locally, we diagnose more hemophiliacs than von Willebrand.
Well, doctors will talk more about von Willebrand and more about hemophilia when MedTalk returns.
Did you know that hemophilia was once popularly tagged as the royal disease? According to the British Medical Journal in 1868, Queen Victoria of England was a carrier of the hemophilia gene. She later on passed the disease to several royal family members, including her 8th child, Leopold, who suffered from frequent hemorrhages.
We're back here on MedTalk, still talking about hemophilia. So doctors, before the break, we were differentiating between hemophilia and von
Von
Willebrand's
Willebrand's
disease.
disease.
Now let's go to the treatment that one should have if one is diagnosed with hemophilia and von Willebrand's disease. Dr. Abiara.
Okay, treatment for hemophiliacs and von Willebrand's are given when they are bleeding.
Only when they are bleeding.
Only when they are bleeding. It depends on the site and the severity of the bleed. And usually, the treatment is giving these patients what is deficient in them. Since hemophilia is factor 8 deficiency, then we give them factor 8, but in the form of concentrates and in the form of blood transfusion.
Even as children, they get blood transfusion
Right.
already?
Yes.
Okay.
And among the blood components that we use in treating hemophilias are cryoprecipitates and fresh frozen plasma. But right now, the safest way to treat them, when I say safest, the risk for viral infection from transfusion is giving them concentrates.
Okay, what is inside this?
These are actually a concentrate of what is the missing factor, factor 8 or factor 9 proteins.
Okay. And that is readily available here in the country?
Right. A factor concentrate, a corollary to what Dr. Abiera's comment, is actually a powdered form of the factor. And it is readily available in the country. However, it's quite expensive, relatively expensive as compared to the blood components that we use. But I agree that it is safer and I think is more useful in terms of providing the adequate levels. More predictable and more consistent amounts of factors are available in concentrates compared to blood components.
So doctors, we have another caller on the line. Good evening, John Sarmiento.
Hello po, good evening po.
Hi, go ahead with your question.
Should a person with hemophilia avoid cuts or wounds?
Thank you, John. Should a person with hemophilia avoid cuts or wounds?
Dr.
Oh yes. That's why any person who has a bleeding tendency should have a well-rounded knowledge on what bleeding precaution is. No? Like for example, as much as possible, they should refrain from using sharp, like yung mga razor, di ba?
Okay.
Diba? So electric razor ang recommended nila. The other thing is when they become old enough, wanted to engage in sports, then they should prevent themselves from engaging into contact sports. Although sports is one of the recommendations is for these people to also strengthen their muscles through sports. But there are sports that they can participate in.
Like what?
For example, is swimming, or low impact running or walking, no? Just so to be able to strengthen their muscles and joints. Because by doing so, they are able to prevent or minimize the recurrent bleed. Because, you know, if the hemophiliacs bleed on his joints, kadalasan yan, they become immobilized, they will not even tend to, you know, to move. And to the point that the muscles become atrophic, weakened. So ang nangyayari, they tend to bleed more. And they tend to give more treatment, which is quite expensive.
Doctors, we have a question now from Twitter. Should I send my child to a special school if he has hemophilia? Dr. Rodriguez?
Well, I don't know if there's a special school for hemophilia in the first place. But I think since there's no special school, I think there's no need to send them to a special school. We try as much as possible to make them live normal lives with, of course, the advice that they avoid extremely physical activities or contact sports that can provoke bleeding. But we advise that for their psychological well-being as well, that we try to maintain normalcy in their lives and try to make them live and grow up as normal as any other male child or adolescent. So there's no need to send to a special school.
Okay. Doctors from Facebook, what pain relievers or medicines should I avoid if I have hemophilia?
Usually the medicines that would affect the platelet. Because, like for example, your ibuprofen.
What happens to the platelet when these
No, because
medicines are taken?
with these drugs like aspirins, no, ibuprofen and NSAIDs, these somehow impair the ability of the platelets function. And therefore, on top of a clotting factor problem, and then you further impair the platelet, then you might exacerbate the bleeding.
So aside from what has been mentioned already, what other medicines should one avoid?
Anti-arthritic, no?
Yeah.
Anti-inflammatory.
Yeah, most of them
NSAIDs.
belong to the non-steroidal anti-inflammatory drugs. And as was mentioned by Doctora, it can actually handicap two of the three components of the bleeding disorder, and therefore make the bleeding worse. That's why we try to avoid them.
And we cannot, one who has been diagnosed with hemophilia cannot avoid but get treatment.
Right.
And one would want to know how much it would cost and what type of procedure should one go through?
Well, for the cost, factor VIII concentrate is available. However, we administer it depending on the weight of the child and depending on the site of the bleeding. There are some areas which require higher replacement levels, especially if they bleed in the brain, head and neck, in the kidneys, or in their iliopsoas muscles. And there are some areas of bleeding where the replacement is minimal, like say in the joints or say in the gums. And therefore, the amount becomes higher as the child becomes heavier and as the site becomes more dangerous. And so if we can compute, say for a 10-kilogram child who has a bleeding in his, say, right knee, he would require at least 30% factor VIII correction if he's hemophilia A. So that means that he may require initially 1 vial of factor concentrate, no? And the amount may range from 250 to 300 units. Now, this would cost around 4,000 to 5,000. So for the first dose is 5,000, and then you repeat it every 8 to 12 hours until the bleeding stops. So from that alone, no, for a very small child with a very minimal bleed, you can easily spend, say, 30,000 in 3 days treatment. Now, as he becomes heavier, you could just imagine how much it would cost. And if the bleeding is in a dangerous site, it will also triple or quadruple the cost. Now, in terms of blood replacement or blood component treatment, one bag requires screening. And it's actually the screening that we pay, not the blood itself, because blood is never sold, it's for free. So the screening for the blood-borne diseases may cost around 1,500 to 1,800 pesos per bag. And for the same child, he may require at least 2 units. And so that will be almost the same as the factor concentrate. And of course, the safety is in favor of the factor concentrate because of the quality preparation and the techniques used to obtain them. And in fact, blood component therapy becomes more expensive because we need to factor the hidden cost, like parents being absent from work. That, of course, entails cost. So at the end of the day, I think blood component treatment can be actually more expensive than factor replacement treatment. So both of them are costly, and both of them can drain the finances of the parents of children with hemophilia.
Since we're talking about children and you're both pediatricians, is the screening, newborn screening, does it include hemophilia already so we can avoid spending this much?
No, it's not, no. I don't know whether it can be really detected by a newborn screen. Because as I've said, that the screening is based on a clotting test.
Okay, so as infants, as newborns, you
And
cannot do
usually
that
the
yet to
newborn
them.
screen is you put it on a filter, on a special paper, no? And how can we diagnose it or screen it if we don't perform clotting test?
Okay. So, it may not be included in newborn screening, but if detected early, then it can be treated. Is it a lifelong disorder, disease?
It is. It is a lifelong disorder, and it's there forever and ever. And we just have to teach our patients, the hemophiliac children who will later become adolescents and adults, how to handle bleeding episodes and how to prevent them, more importantly, because the complications of hemophilia into adulthood can either be a result of the disease itself or from the psychosocial or psychologic impact of the disease. So they become crippled, they may have HIV, hepatitis B or C from the blood transfusions, and as a complication of the treatment, they may also have inhibitors. And as I've mentioned, transfusion transmissible infections. And of course, on the psychosocial side, they may develop mood disorders, depression, some of them, and sometimes passive aggression. And therefore, it is important that we educate both parents and our children who have hemophilia about how to take care of themselves into adulthood.
And in educating the parents and the children, the adults who have hemophilia, there's a national hemophilia organization that can help teach and educate everyone around them to understand more about this disease. Please tell us a little bit about this before we say goodbye. Dr. Abriera?
Well, there is actually a support group that has been formed, no? And they call it HAPLOS, but I think there are 2 already, right?
So there's
Anyway,
HAPLOS and there's another one.
There's HEMAS.
No, actually, the HAPLOS was initiated when I was still training. And we started with a core group of 17 families from UST. And then we started meeting together, and then the meeting became more frequent every now and then one of the parents said, why don't we form a group because we have a common denominator? And then thus the HAPLOS was born, and it became now the foremost support group of the hemophilia. The aim, I think, is to be able to empower its members, to increase their not awareness, but rather understanding of the disease. Because as Dr. Rodriguez
Yes.
said,
Yes, doctor.
okay, it does not only affect the physical, the mental, but also the family dynamics, no, of the patient. We get patients na madalas naghihiwala yung mag-aasawa
Because they don't understand.
the husband, no,
Blame.
blames the mother for the disease.
Because she is the carrier. You know. So, well, you mentioned empower, Dr. Abiera. Thank you very much for empowering all of us to understand this not so common blood disorder.
Right.
Thank you very much, Dr. Rodriguez, also for your time.
Welcome. Our pleasure.
Again, we'd like to thank our doctors for enlightening us more about hemophilia. Join us again next Tuesday, 10 p.m. on the Solar News Channel. This is Angel Jacob for MedTalk. Good night.